Okay, hello. Hello, everyone. Took a minute to get my stuff in order. I had to do a mic check for my guest tonight, who I'll be bringing on shortly. Okay. I just wanted to go live just a smidge early and talk to you guys about a little bit about last night's show, a little bit about what we got coming up, a little bit about this week, right? It's been a while since I've gotten to talk to you guys just one-on-one, just me and you, okay? Or at least it feels like a while. I'm always getting interrupted by callers and guests. And yap, 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 yap. But that's okay. Cernus, nice to see you. Welcome to the show. Right? Make fun of someone who is not here. Okay, let's make fun of Admiral Gibbs. What a weirdo, okay? I've seen him going after counterpoints on my timeline. Maybe we'll make content out of it. I don't know. It should be fun. The Trib 1, nice to see you as well. Welcome to the show. Gang, so I guess I don't know if I liked yesterday's show. I'll be clear. I don't know if I liked it. I don't know if I thought it was even good. It might have been bad, actually. I'm mixed feels, okay? I didn't like the vibes. I didn't like them. I wanted to have a conversation on vigilantism, but everyone else wanted to have a conversation on healthcare. And I get it. They're mixed and they're connected in this specific circumstance. But I just wish we could have focused more on the vigilantism. That's all. So I'm a little like, It was still good content-wise, I suppose, right? But it wasn't the conversation I wanted to have. So, yeah, it is what it is. We get through it, right? We're going to be talking about the healthcare again today, but I planned on it this time, right? So we're good. The Trib 1 says, for the Luigi event, it's about healthcare. It's connected, yes, but I think there is a conversation to be had about vigilantism and how quick people are to turn to it, not just for healthcare-related issues, but anytime they feel wronged. Anytime someone feels like they have been legitimately wronged, that they are a victim of a crime from the system or from an individual, they justify violence as a response. And I think that is in 99.99999% of cases the incorrect move. And it's immoral. But Destiny kept pulling us off that topic, right? He kept like, no, we got to decide this. Do we? But it just frustrated me. That's it. Ren says, every time you asked about it, everyone pretty much agreed it was uncool, though. Not sure there's much a disagreement. Ren, this is another thing that frustrated me about last night. I'll tell you this. Talking to the guests I had before the show, they were much, much more bloodthirsty than they appeared on the show. And I'm not sure if they did that simply because they were afraid of toss. They were afraid to Fed post or whatever. But the throat clearing was annoying. It was. Look, if that's what you believe, man, just own it and we can have the conversation. But this whole backpedaling, like playing pussyfooting around with it, annoyed me. That's it. That's it, right? Other than that, we had some good yelly screamy stuff. We got to know more about car insurance than I ever wanted. But yeah, it was hard to have a direct conversation when everyone's just kind of skirting around what I feel is the core issue at play. At what point does someone get to use extrajudicial violence against their people who have wronged them? Even if I were to grant all the arguments against healthcare, right? All the arguments that Brian Thompson was a shit person who caused the death of thousands, right? Is vigilantism okay? And I say no. I mean, that's my argument, right? That no, it is not okay. We have a system for a reason. I do not trust any of you motherfuckers, okay, to know when it is and is not okay to go out and cap some dude. We have a system in place, okay, for a very good reason. We don't want to go back to lynchings, right? We don't. And so many people are capping for that. They're cheering that on. And I find it disgusting. But I wanted to have more of a focus on that conversation than healthcare overall, right? Because what I feel like last night's conversation ended up being is everyone was saying, well, in this case, it's okay because it's bad enough. And that was the argument, right? Whether it was bad enough. And I think that there are times, right, when I understand when the law doesn't exist, then you have to take matters into your own hands because the law just doesn't exist, right? Or it's so corrupt that there is no recourse. But that's a sci-fi world, right? America is not anywhere near that, right? We can point to people being lawsuits, especially, right, against these companies. They do pay a price. I don't know, but that is what it is. Pinks BB says the car insurance content is irresistible. Maybe. James Mackey says, in a group, it's easy to get hyped over, yes, but a single query demolishes their setup, like Desk from Temu. I don't know what Desk from Temu is, but fair enough. I will just take your analogy in the spirit it was given and say, yeah, brother. Hell yeah. But it's I don't know. I think that the American system is not perfect by any means. The legal system, to be clear. And I don't like the American healthcare system for a wide variety of reasons. But again, as I tried to get across, like, there's no line here. There's no limiting principle. If you think that Brian Thompson deserved death for being indirectly causing harm to others, right? Even if I grant that argument, then so do the lawyers that fight for him in his lawsuit. So do the actuaries who deal with like what levels they're going to pay out what coverage. So does the people selling that coverage. So does almost everyone down the line, including podcasters who run defense for it. They're all responsible. And I think that people need to be willing, if you're going to have that stance, you need to be willing with what that stance means. What that stance means is blood in the streets. Like, the amount of people who die because of health insurance or lack thereof is going to be dwarfed by the amount of people who receive punishment for being involved indirectly in harming others. Because, oh my God, there's a ton. The Trib One says, in a failed state, it's justified to do that against the real movers and shakers. It would never be against the CEO because they unironically don't have the power for their death to change for the greater good. Night of Day says, you mean it's not okay to shoot someone in the In-N-Out Burger parking lot? No, it's not. Vigilantism is bad, not just because you're killing someone, but because what that does to society. It breaks down the order of society. And the order of society is a good thing. It leads to human flourishing, okay? It protects us. It protects me. It protects you, okay? The fact that we do not solve our differences by going out in the streets armed is what separates us from, like, actual failed states like Afghanistan or Iran and things like that. Only Mr. Bill says, you are asking your leftist friends to follow logical connections? You have a poor view of people, only Mr. Bill. Okay. Only Mr. Bill. I think that people can follow logical conclusions. I think they're more than capable of it. But anyway, tonight, we're going to be talking about the Affordable Care Act. I was approached by a gentleman. Someone's been on my show a couple times before, Principles Before Politics, and he wanted to have a discussion about it. Why not, right? It's in everyone's minds. Let's bring him on. Let's say hi. Let's get to know him. Should be fun. Cool. Cool. Hi, you're live. God. Okay, we'll fix it. He'll get it.
Yep.
Oh, there we
There we
are.
go.
There we
Yep.
are.
I
Yeah.
think it's just a delay.
Yeah. Okay. So, the Affordable Care Act. So, tell us a little bit, or tell my audience what you're comfortable with, because you approached me with this topic, and you said you had some experience with it. Can you share what you feel comfortable sharing with the audience? Go ahead.
Sure, sure. So I guess let me start maybe with the sort of elephant in the room here. I've shown up before as the cartoon cat, and this felt like it was a little bit more of a important subject to not, kind of be so flip about it when I've come on like for panel shows. That's a little different. I'm coming here to talk about my opinions and whatnot. This is something that hits a little closer to home because it's a project I worked on, and I have a little bit of insider experience. So I thought it would be more appropriate to treat it with a little bit more seriousness. And the complicating factor is that, based on the nature of the discussion and the way that Washington can be about these things, I'm not real comfortable showing my face. But to help the audience understand a little bit better, why I wanted to have this conversation, I took a job with a fairly large consulting firm when I was a young guy, relatively fresh out of college, and Obamacare was the project. I actually got the job on the back of a recommendation from a gentleman I knew from college who was a manager with the IRS. He happened to know someone who worked at this large firm, put my name in. So I was working as an internal auditor. With this organization, and our contract was with CMS, the Centers for Medicare and Medicaid Services. For anybody who's not familiar with this, the Affordable Care Act is administered by CMS, which is a branch of the Federal Department of Health and Human Services. So, by way of the federal hierarchy, we were working with HHS. But if you want to be technical and specific about it, we were working directly with CMS. And our role involved my team was involved with improper payments. I mentioned I was an internal auditor, and so obviously their transfer payments were a significant part of what my role was. And in order to understand if a payment is properly authorized or if it's an improper payment, and in order to understand whether an improper payment should never have been issued at all, or whether it's functionally a clerical error and an indicator that you need to tighten up your internal controls, you need to understand the total process. So my background coming into that was, being in an environment that's high pressure. The folks that are there that are already lifers with the company, this is something they really need to succeed. During my time on the project, we watched the catastrophic failure of healthcare.gov, and that CGI lost their contract. It went to Accenture. Now, I mentioned to Wick in private that I'm not super comfortable talking about exactly which contractor I worked for, because I'm trying to avoid ruffling feathers with the wrong people. It's probably an abundance of caution kind of thing. I'm probably not in that much trouble because I was basically a cog in the machine, but it's the sort of thing that you just don't want to be making enemies of certain folks,
I
right?
understand.
And if I'm gonna be talking about having been in the room with the folks at the top of CMS and knowing the same things that they knew, and things that probably haven't come out in the press, and you know are less well understood or less discussed aspects of this, I just felt like a little anonymity probably does
Sure.
me well there.
No, I understand, and appreciate you bringing this to me. And I have questions. My audience has questions. They're already asking them. But I want to start maybe. I think perhaps, and you might disagree, and you can tell me if you do. Maybe we can start general and kind of nail down into the specifics. So I'll give you my understanding, because again, I was an adult when Obama was trying to pass the Affordable Care Act, Obamacare as they call it, and I can speak to insurance before and what it was pitched as, and you can tell me how accurate my memory is here, and you can kind of correct any errors of perception I might have. Does that sound good? Okay.
Sure.
Sure. So again, at the time, one of the big issues in healthcare and with health services is that health insurance providers can deny you coverage for pre-existing conditions. And so if you were diagnosed early with a chronic illness or a disease, you couldn't in retrospect get insurance, right? You couldn't then get really good insurance to cover that condition. Only the conditions that were discovered while you already had insurance would they be required to cover and things like that. And it was a real issue at the time, that people were being denied coverage, couldn't get care, and there was a lot of suffering with healthcare in America. Now, Obamacare promised to alleviate that suffering, to allow coverage, or not to allow, but to require coverage for pre-existing conditions and things like that. There were some trade-offs that were made, like people would have to pay into it and things like that. But there was a large debate. It eventually got passed, and now it is what it is now. Was that relatively accurate reading of the situation, or correct me if I'm wrong here?
Um, well, I would say from sort of a layman's perspective. Remember, I'm offering a certain level of I was there at the time to give you the nuance myself. So I'm not going to blame you for there being a little bit of a lack of nuance there.
Yeah.
Broadly speaking, I would say, again, if you're going by what you would have heard in the media, the way you described the pre-existing condition thing is mostly accurate. There's plenty of nuance to unpack there, but that's far from the place to sort of start picking apart. What I would say is that in terms of like trade-offs, the congressional bloodbath that took place over this, I think you undersold a little bit. But I'm also going to say that in terms of the policy people, when you're there's a big difference between the way that say Mitch McConnell or Nancy Pelosi is going to talk about these issues in a national press conference versus the way that Kathleen Sebelius is going to do in a staff briefing for HHS. Right? It's just fundamentally two
Sure.
different worlds.
Give us how it was
So
pitched to you guys.
basically, that we were going to be setting up this program, and that we had fundamentally two goals. That this was a monumental effort in terms of overhauling public policy for healthcare provision, and that fundamentally there were two big things that we were trying to accomplish. Number one was to expand access. That touches on what you were talking about with pre-existing conditions. It also touches on some other stuff that's kind of adjacent or tangential to that you didn't touch on yet, but that would be part of it, as well as addressing folks who just straight up couldn't afford it, right? That from an accessibility perspective, the problem was just straight up, I cannot pay for it. The second big goal was to control cost. And again, there's plenty of nuance to unpack there, but if you were in the room, there was a phrase we heard a lot of, which was "bend the curve." And I know in
Yeah,
the
what does that
current
mean? You're
parlance,
gonna have to elaborate, okay?
in the current parlance, we've been hearing a lot about how you don't have zero or negative inflation, right? That cost always goes up. Of course, that makes sense unless you're literally in a recession. Well,
Mm-hmm.
that was the way that reality was being expressed at the time. Was, well, costs are going to go up, of course, but we're trying to reduce the growth rate. We're trying to bring it down, make it a smaller portion of
Ease
spending as a
people
percentage of
into it,
GDP.
kinda, right? So it didn't hit all at once, but instead slowly increased.
No, no, no. That again, in terms of like inflationary pressure, costs always go up, right?
Yeah.
But that healthcare in particular was sort of a runaway train, and they wanted to harness that and slow it down and say this is becoming a problem area within the total U.S. economy. So in order to help address that, we're doing this whole big package of stuff, but in terms of two big goals, one is access and the other is prevent costs from running away the way they have been.
Interesting. So again, as I hear it, two-third, increase access, prevent runaway costs to kind of slow down the price increase. Is that an
Well, and
accurate
price
retelling?
isn't even the right word for it, right? Because
Cost increase.
Well, this is one of the things that gets tricky with this is that health insurance and healthcare aren't the same thing, right? So when we're talking about the access question, we're mostly talking about insurance. When we're talking about the cost side, we're mostly talking about healthcare because we're talking about the actual provision being administered. And in the case of folks who had an access problem based on cost, one of the key ways that that was addressed was through Medicaid expansion, where for folks who aren't familiar with this, Medicaid is basically a transfer payment directly to you to pay your doctor. Um, that's a gross oversimplification, but hey, I wasn't working on Medicaid; I was working on Obamacare. Um, the idea there is that it is literally money from the government to pay for your doctor, right? It's not insurance in the traditional sense; it is a direct subsidy. So when we talk about the access issue, again, we're mostly talking about the insurance piece. Do I have some kind of insurance that I can use to gain access to the system? But then when we're talking about the cost control piece, we're talking about total health care, because one of the proposed ways that you address this. Is by pushing healthy people into the risk pools. That healthy people don't produce a lot of cost, but they do contribute in the form of premiums. So if you have those premiums being paid in, you're creating an environment where that money is then available to pay for other folks. But because you're also bringing them in when they're healthier, generally speaking, when they're younger, you're also then encouraging them to get preventive treatments, to go in for routine care, to get things caught early. That if you're catching things early, generally they're more treatable. The treatments are less costly. So the cost control thing is complicated, right? It's not just so simply we want to see smaller dollar signs or we want the price of this or that service to go down. A lot of folks will bring up stuff like prescription drugs, and I think it's very telling that when you look at the prescription drug side of this issue, you have multiple online pharmacies and other options that are operating in a competitive market environment to provide consumers with choice as to how they're going to tackle whether it is, say, you need like insulin, or maybe you need EpiPens, or maybe you need a statin or a beta blocker. It doesn't matter what the drug is that you're taking that's a maintenance med, something that you basically need to continue to take over time. That it's not something that's treating an acute illness
Certainly,
or
yeah. I get what
but,
you're
but
saying.
basically, that again, the cost thing is squishy, but there is an important distinction there.
So
Um,
let's just focus on those two things, right? For a moment, right? Do you, in your opinion, do you think that the Affordable Care Act has been successful in its two stated goals as you have presented them, which are control costs and provide access?
I would say that when it comes to enabling access, a middling job was done, a mediocre job was done. Um, it was good. I want to be clear because as we get into this conversation, we're going to get into the kind of uncomfortable math that involves trying to put a dollar sign on pain or discomfort or quality of life or yes, even death. The folks in my position on this project were the folks being accused of establishing death panels. So, being accused of being heartless for having a sober conversation about the realities here is not outside of my realm of reality. But I would say on the access thing, it was good. I think what was done there was positive, but it's not the kind of thing that you're going to write home about and say this was a massive smashing success. I think there were significant groups that had access problems that fundamentally got nothing from Obamacare. That it just did not address their access issues because it wasn't intended to address their access issues. So of those folks, nothing was done. This is
Can you
why I
give
would
us an
call it a
example of
mediocre.
that kind of the person who has had access issues before, who of the Affordable Care Act or Obamacare did not address? Can you give us an example of that?
The classic example would be an independent contractor or someone who's self-employed.
Okay.
That in terms of how their tax situation shakes out, they have a larger on paper income than someone who works a W-2 job.
Okay.
And when you look at the subsidy programs and some of the other support programs that were available through the Affordable Care Act and before that, right, also including things like Medicare and Medicaid in that are part of this conversation. When you look at the totality of circumstances, fundamentally, we had a group of people who didn't qualify for any of these support programs basically because of some accounting, right? The way the number looks on paper. Um, And those folks really could have used a leg up into the individual marketplace because that they are almost by definition individual marketplace customers. If you're self-employed or if you're an independent contractor, you're not getting benefits from your employer,
Yeah.
and or fundamentally you are your own employer. So you're going out to get your own insurance. They definitely could have used that benefit, but again, because of the way the math gets done on who gets subsidy support and who, or I'm sorry, not subsidy, but premium support and who doesn't. Um, you're not gonna see any kind of improvement for somebody who's in that sort of marginal group where they're not doing crazy bad, they're not in poverty, but they're certainly not living well by anyone else's standards because nobody's paying half of their FICA, right? They're paying twice in income tax that you are.
No, I get what you mean. So there were people who didn't quite make the cut, who could have used some help, who needed some help, who didn't get it. I understand. So,
It's not even about not quite making the cut. If you're in that particular group because of again, that it's like 6% of your income. It's not a small difference.
mm,
Um,
yeah, hello? Hello?
yeah, no, oh, did you lose me?
No, you're still here. Go ahead. You just cut off, and I'm curious why.
Well, no, it's 6%, right? That's
Yeah,
that's not
yeah,
a small difference in terms of what somebody's income
I
is. So when we're
understand.
talking about somebody who's not getting premium support, we're not talking about somebody who's necessarily just barely missing it. We're talking about somebody who is getting denied access to the program because on paper they're way outside the realms of what we're going to provide any kind of premium support for.
Okay, I get you.
That this fundamentally this category of worker is not going to be targeted for any kind of relief.
So when we talk about the second part, cost control, what do you think the Affordable Care Act has been successful in that? Why or why not?
I it's been an embarrassing failure.
Why? What? Why?
Um,
How did that fail? Right? Go ahead.
so uh, so here's a couple of bottom line figures. You heard me say this earlier about um, how insurance and healthcare aren't the same thing, right? And when we're talking about the cost metric, generally people are trying to measure the cost of healthcare. But the cost of healthcare doesn't take into account things like deferred care. If somebody says, I can't afford this treatment right now, I'll wait till next year. That doesn't show up as a cost because no money traded hands, but that's a cost, if you will, in a more utilitarian sense of the system, that somebody is deferring care because they can't afford it. Um, in terms of where you see the cost numbers go over time, there's fundamentally no meaningful change. The biggest statistical changes you're going to see in health care costs in the United States from you can go back further than this, but we'll say as a reasonable cutoff point, let's start at 2000, because that's you can start with the two terms of Bush before Obama, and Obamacare came in during his term, and it was being implemented throughout his term. Most of it came online in 2014, I want to say, which would have been roughly speaking 3/4 of the way through the Obama term. So you've got a nice big chunk of time before Obamacare's in place, and you got a nice big chunk of time after Obamacare's in place. The only place you're going to see any kind of meaningful change in the growth rate of cost is COVID, and
Interesting.
I think everybody is pretty well aware. Again, within these kind of policy circles, I don't think anybody is looking at the bump from COVID and thinking, "Oh, well, that's indicative of some systemic thing that we need to fix." That's clearly an outlier event that is just
Absolutely. It
giving
was
us
kind of like a
some complicated data that makes it trickier to read the total picture.
once in
But you
generation
certainly
kind
aren't
of
going to
thing. Yeah.
see you're certainly not going to see any kind of significant drop. You're going to get rosy press releases from the Obama administration, but 1/4 of okay cost growth is not indicative of a trend line. And the bigger issue here is that many of the programs that were intended to address some of those cost concerns were poorly crafted. Some of them were designed to fail.
Can you give us an
Um,
example of one of those? Something that was because you said that it was an embarrassing failure was the words you used. What did how did the ACA try to do this, and why did those efforts fail? Give it in if when you tell us about this, please use specific examples. Like this was a program they tried to implement, it didn't work because X, Y, Z. Right? Go ahead.
Sure. So bear in mind that again, this is in terms of controlling costs. There's this whole big constellation of stuff, right? Part of the reason that you have to take it in the totality of this constellation of stuff is that one of the access issues, as we mentioned earlier, was folks with pre-existing conditions. So even addressing the access issue at all necessitated driving up cost. So with cost being the other goal, we need to take into account that this isn't like one singular thing was supposed to fix everything. But an easy example would be the state exchanges. These were designed to make it possible for smaller insurers to have a bigger presence in the insurance marketplace. That if you think about like insurance aggregators that you can find pretty easily for stuff like car insurance or homeowners insurance, right? You just plug in basic stuff. Here's the car I drive the year, and here's the state I live in, and they'll spit out for you a dozen different insurance quotes from various insurance providers. Pre-Obamacare, it's pretty hard to get that kind of comparison for health insurance. Some of them are going to require you to go get a physical. Some of them don't offer insurance to people in specific states. It's just a tricky thing to get your head around as an individual consumer. So the purpose of the exchanges is to make it easier for people to be able to find and compare their options. Part of the goal there included the I want to say they refer to them as co-ops. Now, these were basically small, brand new insurers that were being instantiated in, I think most, if not all, of the states.
Okay.
And because they're brand.
Was this because of the ACA, or was this something that was happening and the ACA tried to utilize those?
No. This is directly part of the state exchange program. That these.
Okay, so it's part of the ACA.
Yeah.
Okay, go ahead.
I'm butchering this a little bit, but we're going to get to the ugly part in a second.
Go ahead.
And the ugly part is probably why I'm not remembering particularly well how you set one of these things up in the first place.
Yeah,
so the big issue is that we're creating brand new insurance companies. And for a brand new insurance company, you have no idea how to price your product. The best you can do is look at other people's prices and say, I guess that's close enough. But realistically, what you're doing is you're hiring someone called an actuary. And an actuary does all that gross math that I described, and they'll tell you when somebody comes in with a diagnosis of stage 2 breast cancer, here's what that's supposed to cost.
And here, then, let me make a little money. Let me do my actuary work. So $5 from the Trib one to say, was there a way to make Obamacare work? If not, what do you think will, as far as cover as many people as possible? Because if I may, just a moment, right? Like one of the problems with discussing this is it's so fraught of a topic. You need so much back knowledge, you need so much information that the layman, that the normal person simply doesn't have access to in many cases, right? And it's so gargantuan of a topic that it's hard to really choose where to start with it. Even
that's fair. That's fair.
It's really hard. If I may finish, it's just really hard to kind of, because everything you are addressing and introducing, we have to stop and explain it, right? Like when you talked about like the co-op care and things like that, we have to, okay, is this something that Obamacare was instantiating? Was it something they were utilizing? What does it look like? And there are thousands of moving bits like this that we kind of have to address. But I would like you to kind of like, before we get into the nitty gritty of what we were about to, if we just take a moment and talk to Trib One's question. Was Obamacare doomed as a concept, or if we had instantiated it in a different manner, could it have been successful? And if not, if it just ain't going to succeed, what do you think will? Go ahead.
It was doomed. But again, part of this is because some of the provisions that were in it, when you looked at them on paper, I guess if you looked at them through a certain kind of rose-tinted glasses, you could come to the conclusion that it might work in theory. But if you were really thinking about how market incentives work, several of these programs were clearly never going to work. That they were going to collapse under their own weight, or they just wouldn't ever come to fruition. So I don't know that there was a way that you could just do it better. And I'll do my best to cut to the chase on a couple of the bigger examples of that. But in terms of how would you actually accomplish this? It boils down to fixing the problems with the incentive structure. That when you're looking at the reason the cost is
The
high,
incentive structure for who? For the
everyone
consumer?
involved,
For everyone involved. Okay.
everyone
Carry
involved.
on.
For consumers, for insurance companies, for doctors, for the government's involvement, everybody involved has fucked up, perverse incentives. Nobody involved in this has clean hands.
Okay, carry on. I was just wanting to clarify. That's all.
No, that's fair. But I mean, again, I think people don't want to hear oh yeah, we're blaming the consumer, but to a certain extent in this case, yeah, we are, because folks who are young have a certain mentality of invulnerability, and they don't sign up for the kind of coverage that would be necessary to catch things early, and they don't wind up showing up for treatment until it's already gotten worse. So in terms of how you actually address those things, yeah, it does involve doing a little bit of blaming the consumer, because the only way that you're going to control that cost is by getting that person into the kind of care that they need earlier. You need to encourage them to think about protecting their whole health at a time when they still have all of it.
How does one
That's
even...
not a very easy thing to do.
Yeah, I was going to ask, like, how would one even go about doing that? The only ways I can think of
Obamacare
are...
tried to do it with an individual mandate, which ultimately is no longer there.
Yeah, well, that's part of the problem, right?
Well,
Is the...
no.
No? Because you just said that this was a necessary thing.
Well, so again, some of this was constructed in such a way that it was always going to fail. The individual mandate was never built with any teeth. The enforcement mechanism for the individual mandate was something called a 1095. It was a form you filed with your taxes that basically said either I'm checking a box that indicates, for example, that I am on Medicare, or that I have employer insurance, or I'm providing information about the individual policy that I have. 1095s were issued for a couple years, but the IRS literally in their guidance after year said your 1095 form has nothing to do with your income taxes. You're just supposed to file it. And then when President Trump came into office, I can't remember exactly where this came from, but the IRS penalty for basically failing to turn in a 1095 was reduced to $0. So, like, it's the kind of thing that you could have always predicted was going to go that way, because nobody wanted to enforce it. And when somebody was finally asked, "What are you going to do about this?" the answer was, "Well, we're just going to take all the penalties out."
Which, again,
To that point,
is a problem.
speaking of programs that were destined to fail, risk corridors is another good example of this.
Okay, again, I hate to be that guy. Risk corridors. What does that mean? What is that?
So there's a group of policies that are called premium stabilization plans. Premium stabilization programs. The purpose of these is to provide support to the insurance companies during the transition period when Obamacare is first getting set up, right? Up to this point, everyone's actuaries have been doing the math, assuming that they could tell somebody, yeah, we're just not going to insure you. But also, to speak to, again, some of the other access problems, they could also do things like say, yeah, your treatment for colon cancer is capped at $100,000. It doesn't matter how much treatment you need. We'll pay $100,000 and then you're on your own. Or they could terminate your policy because you had gotten a diagnosis of something that they didn't want to pay for. They have to redo how they're doing all their math, because they're now required to pay for all sorts of stuff that they've been assiduously avoiding paying for. That's not a simple thing to do. So the purpose of these programs was to kind of cushion the blow. So there's 3 programs, 1 permanent, 2 temporary. Permanent program is called risk adjustment. Then you've got two temporary programs called reinsurance and
this is
corridors.
within the confines
of
all
within ACA.
Okay,
It's all within ACA.
Please.
In broad strokes, risk adjustment is basically these things all have to do with how risk is calculated. That's where they get their names from. But risk adjustment is fundamentally looking at what your risk looks like before any claims have come in. Reinsurance is looking at what your risk looks like after all the claims have come in. So in other words, if you've got insurance company A and insurance company B, and insurance company A, for whatever reason, all the cancer patients sign up for insurance company A. Just nobody with cancer ever looks at the B plan and goes, yeah, I want that one. They all sign up with company A. So risk adjustment is going to say, hey, company B, you owe a whole bunch of money over to company A because they're insuring all of these cancer patients.
Really?
That's the
So
permanent program.
you would have one insurance company being required by law to give money to a insurance company who covers more at-risk
No, to
patients?
CMS. They have to pay the money to CMS. Basically, the CMS is looking at the data for all the insurance companies in your state, and they're comparing everyone's RA scores.
So
Um,
so what would
and
CMS give them money to?
they would give it to a different insurance company. But you're framing it as though insurance company A literally gets paid by insurance company B,
Well,
where
isn't
there
it
there is a middleman step here where I'm kind of oversimplifying this because it's for all insurance companies across the entire United States.
well, fair enough. No, I get it. These are very complex, but I mean, yes, there's a middleman, but ultimately B is subsidizing A.
Yes, and that's the permanent program.
Okay, got
Um,
you.
and again, that is aimed at addressing part of the access problem, that you don't want insurance companies to be trying to create their insurance plans in a way that discriminates out the costly people. You want them to be as agnostic to that as possible, so
Got
if
you.
they happen to be the one who attracts all of them, well, then they happen to get some money to help them pay for those more expensive
Yeah,
customers.
they get like a little bit of a, for like a better term, like a subsidy for it. Yeah.
Yeah.
Okay.
We're going to come back to that in a second, but we're talking about abject
That's
failure,
a
so I want
one.
to get to
Just
risk
again,
corridors.
viewers. I'm trying to help you follow along this one because I'm trying to follow along with
Okay,
it.
then
That's
let me
one.
dive back into this.
That's one.
So
Right. Go ahead.
big problem with risk adjustment. Big problem with risk adjustment. Everybody in the room knew this the minute it was happening. Was that there was this thing called a default payment, and default payments were like, if we're talking about elephants in the room, this was an entire conference room full of elephants in the room. When somebody stands up in front of a group of intelligent people who are here trying to work on this and solve this and says, yeah, if an insurance company has an atrocious risk adjustment score and they decide that it would cost them less money to take the penalty for not reporting it, they can just not report it and take the penalty instead. Guess what was expected to happen the very first time risk adjustment was being collected? The three largest health insurance companies in the United States all were expecting to be taking default payments because they weren't going to be giving their risk adjustment.
How was the system designed to handle that, or was it?
That was the way it was designed to be addressed, but you got to remember that we're talking about a program that's billions of dollars in size. Now, for any
Certainly.
individual health insurance company, it's only going to be a couple million, but if I have a choice between paying $12 million or paying $2 million, it's not complicated to figure out what every insurance CEO is going to decide. That's not a matter of being evil. That's just been given a choice, 12 or 2. Which one do you want to pay?
That makes sense. How how has this negatively impacted people's healthcare, or has it?
It's less about how it affects healthcare. It's more about the insurance side and the access, because the whole purpose of the program was to support insurance companies, right?
Okay.
To help them address the uncertainty when it came to pricing in the market post changes. So having these funds come up in many cases tens and hundreds of millions of dollars short meant that insurance companies that were getting the short end of the stick, that were expecting and depending on these transfer payments, were getting smaller payments than expected or no payments at all.
So what ended up happening in the system because of this?
Insurance companies went out of business. That's what I was trying to get to with the exchanges. That those
Okay.
co-ops, they don't exist.
Okay.
They're gone.
Great.
All of
So
them failed.
we
100% of them failed.
ACA tried to make out these co-ops to get these things going, and they all failed. Every single one went out of business.
At the time I stopped paying attention to it, I think there was a handful left. I don't want to give a specific number, but
Okay.
I'm confident saying at least 30 or 40 of them failed by the time I was done working on Obamacare.
A good portion would be fair to
Well,
say.
well over three quarters.
Well over three-quarters. Wow. Um, is there anything that has been done to try to replace or to counteract the harm to the system, to ACA, that this loss of one of the pillars of it has provided?
Well, Not really, but again, when we're talking about the cost control piece, I said it was an abject failure. So
Fair.
that's
Yeah.
one piece of it is this risk adjustment thing where there's this known problem of in the earliest years, that's when people are most likely to have made giant mistakes in their actuarial math, where they're likely to have these giant payments, where the other people are going to have had the same problems in the other direction. Um, you're expecting that money. Risk corridors is another great example of this because risk corridors, the purpose of that program was to literally share profit. Same concept, right? But in this time, instead of talking about who insured the riskier patients, we're literally saying insurance company A made a profit of 1%, insurance company B made a profit of 12%, insurance company A gets a couple points from company B. Um, Again, same middleman crap, but basically the idea here is that there is this temporary window, I believe it was 3 years, where as this stuff is rolling out, we know that the math is going to be fluctuating and everybody's going to be doing their best to figure it out, but we want to make it so that the companies can operate with a sense of confidence and certainty, right? That even if they don't have perfect math, they're not going to get failed out of the market by that because these programs exist to support them up and down. But the only
Mm.
companies that really benefited from that were the big ones because all the small ones were the ones who tended to be the ones on the short end of the stick in terms of underfunded programs. Risk corridors never happened. Risk
Wow.
corridors has never been paid. Um, it was so embarrassing that at the time I was working on the project, I mentioned that my program was improper payments. We were informed that our team was not going to be needed for the risk corridor program because it was impossible to have an improper payment if no payments were going to be issued.
Wow. That's
That was later
definitely,
challenged in court,
yeah.
and it has since been ruled that the risk corridor payments are owed. That is a federal debt and an obligation that has to be fulfilled. But that's kind of a cold benefit for an insurance company that's already out of business.
Yeah, I mean, like, it's a cold comfort, if you will.
Yeah,
$5
thank you.
from the Trib one. Do you think Americans would be okay with covering the cost of healthcare through taxes instead of insurance, while keeping everything else the same?
Um, I think that's part of how you get there. If you're looking at a way to actually solve the problem, because I think part of the issue, if you look at the cost side, and again, uncomfortable math, a lot of this winds up becoming a transfer from young people to older people. Young people generally earlier in their careers have less money, so you're talking about a transfer from poor people to wealthy people. The way that the law is structured is really not a system that is ever going to get those marginal people to feel any better about the system to buy into it. Whereas if the money was already coming out of your paycheck in the form of taxes and you knew that you had some method of, exercising that healthcare provision, then you have a better case to make for maybe like a public awareness campaign to say, hey, people come in for mammograms and colonoscopies and, whatever the case may be. Folks come in here and get your routine screenings because you have this healthcare provision that's provided by the government. Um,
Yeah,
but
let's.
it's not as simple as like Medicare for all because that's just all that does is shuffle around who's paying for it, right?
Nah, I feel you. I feel you. Let's. I wanna address this because I think it's a question that comes up all the time and a comparison that comes up constantly. And I'm curious, as someone who's worked on the various programs and has worked in the industry, even tangentially, you might have a little more information than the normie does. So a lot of people say things like, well, we can just in America adopt a system such as Canada or such as one of the Nordic models, right? Do you think that that is a realistic thing that
No.
America can strive to? Why or why not?
Yeah, the why or why not is the more interesting part of the question because
Yeah,
I don't even
that's
need you to finish the question to tell you no, that's not realistic.
okay.
Um,
Go ahead.
So there are significant differences between a lot of the countries that people will point to. I can use Canada. I don't know. I can't remember offhand what their health service is referred to as, but then also the NHS in the UK and Norway. I also happen to have a personal background with. That's more complicated. That's personal.
Fair enough.
um, But those three are decent enough examples because those are that kind of touches on, again, Canada, and then a well-known example in the NHS, and then the more
Yeah.
Nordic model
Well,
kind of socialist
the
kind of
reason
thing.
again, just to before you get too into the whys and the why nots, is the reason I bring it up is because that's what a lot of people are advocating for. They say America's healthcare system sucks. We need to be more like Canada, or we need to be more like Sweden, or whatever, right? Um, yeah, go ahead. Why is that bullshit?
So there's a number of problems with that, and I guess I'll try to keep it brief and touch on just a couple. I think the easiest place to touch on would be just the overall infrastructure. That people will happily point to, like, oh, administrative costs, but they fail to understand very basic things like when you go to a hospital network, generally speaking, the hospital is the owner of the building, and that's about it. That the
Are we
individual
talking
doctors that
in
you're
the sense of the American system, or are we talking in the
Yes,
sense?
in the sense of the
Okay,
American
go
system.
ahead, please.
That the doctors that work at your local hospital, generally speaking, do not work for the hospital. They're contractors for the hospital. They have their own private practice, their own support staff in terms of sometimes there's like shared nursing, but a lot of times they'll bring their own nurses with them. They may even have their own admin staff, like their own secretary or whatever. Or receptionist or front desk, or whatever is the correct term to use for that. But on top of that, you're also looking at certain things that these individual doctors are doing on their own that you might again otherwise assume goes to the hospital, like malpractice insurance. That there's probably a provision for the hospital for like things that take place in the hospital so that you can't sue them, right? They're going to have some kind of insurance to cover their own rear end. But when you think about, like the doctor who leaves a clamp in you during surgery, you're going to have to go after that specific doctor. Um, that's very different than when you compare that to, a UK or a Canada where a lot of their doctors are government employees. That's a different system. You're also not going to be able to just very easily say, oh, well, we'll just hire all the private doctors and make them public servants. That is one of the things that, again, it's one of those elephants in the room is uh, part of the friction and part of the cost control problems come from the providers themselves, from the doctors who are inflating their charges, who are coding things for purely the sake of profit. And who have their own different set of incentives to work with.
So, but why
At the
couldn't
time that this was being proposed, one of the big things that was coming from the industry groups was, well, go ahead and do that. A bunch of us doctors will just retire, and then you're going to have a shortage of doctors, and you wouldn't like that, would you? It was completely mafia-esque the way that we were being talked to by these industry groups that were basically strong arming everyone in the room to say, no, you're not going to make changes like that would affect our business and our industry. We like it the way it is. And again, you talk to doctors about certain things, they'll tell, oh, well, it's so expensive to go to school, as though it wasn't possible to set up a subsidy program where you said, hey, go get a degree as a doctor, become a public doctor. You don't have to pay any tuition at all. You just need to not have like 10 malpractice claims against you in your first 10
but
years.
why couldn't
Like,
like
think about the easy solutions.
yeah.
But the doctors groups don't like that because it's competition
So
for them.
fuck them.
And in the
Like, why
current
do we have
system,
to listen to them? Why can't we just say, okay, we're going to call your bluff, much like Reagan did when he fired all
because
those
you
air
don't.
traffic controllers? You remember that whole thing, right?
Oh,
A
I
bunch of
remember that, but there's a
aircrafters.
fundamental difference between somebody who has the qualifications to serve as an air traffic controller and someone who's qualified to serve as a heart surgeon.
Fair enough.
Like, you can't just flip a switch and replace these people, and they know that.
Oh, fair enough. Fair enough.
So
So
again, in
they do
terms of
have
why
us
don't we
over
just
a
go to one of these
barrel, is
other
what you're
systems?
saying.
I'm sorry.
They have us over a barrel, is what you're saying. Like they
No,
are
they don't
in
have us over a
control.
barrel by any imagination. It's just that there's no political will to do anything about it.
But you just said again,
Because you could
like, so,
you could
hold
make it
on,
easier.
if I may, let's run this through. So we do call their bluff. They say, try it. We'll just all retire, and say, okay, fine, we'll do that. They all retire. Now we have a shortage, right? A huge shortage, nationwide shortage. We already do, by the way, but it's exasperated. A ton of deaths happen because they can't get access to care. And that just kills any political will for the system. I mean, I don't see a realistic way to overcome that. Am I
Well,
wrong?
sure. Well, the issue is that realistically that would never happen. That when you're looking at these programs, we're not talking again about flipping light switches. That the goal here would be to come up with a program that increases the supply of properly credentialed and trained physicians. That we have a great system right now for cranking out nurses, but nurses are not doctors. And there's a lot of work in nursing that doesn't really add a whole lot in any kind of meaningful way. If you don't understand what I mean, ask a few male nurses what their typical shift looks like. A lot of the sort of prejudicial or stereotypical attitudes about like this is girls' work, this is boys' work, translates into okay, the person who needs to lift this person up off their bed is going to be the male nurse. The person who needs to push them down the hallway is going to be the male nurse. That's evidence of the level of kind of qualification that you're attracting there. We need doctors, not nurses. But you could solve that with programs that were intended to either attract them from overseas and make it easier for them to credential here, right? To streamline the credentialing process and get that
H-1B
barrier out of the
visas,
way.
maybe, right?
Maybe.
Yeah.
But again, this again, it goes right back to the industry groups because they're going to say, oh, well, if you come from this or that country, you're not credentialed. That's not equivalent. They like to play these fancy games about exactly what school you went to and whether you can pass this or that exam when you immigrate. I'm not saying there should be no controls on that sort of thing. Of course, we want to make sure that people that we're bringing over for that purpose are properly educated and functional. But I can't imagine that it's impossible to find a doctor, right? We're not looking for the world's foremost nuclear technicians. We're looking for people who know how to put in a pacemaker.
Yeah.
And similarly, you can be looking at tuition programs and educational benefits that make it easier for people to get into the profession in such a way that they are, again, think of like subsidized care, that if that individual has the backing of the US government for their tuition, then they can afford to be involved in some kind of reduced payment program because they're not paying back the same student debt that somebody who did it without that program is. So now you've got a new system of doctors that you can use to advance access to care in a way that is directly targeting the cost by increasing the supply.
Okay, that's one reason that we can't have a Canadian system. What are some others?
Well, I
Or
started
is that
getting into
just kind of like
hospital
the
info.
major one?
That's a big one, but another one
Okay.
I touched on hospital infrastructure. This is something that a lot of people don't think about. Americans have a kind of unique expectation of privacy in medical care that just isn't present in countries that have those more
What do you mean?
nationalized systems. Well, so again, this is not to imply that like you have to undress in front of people or something, but like if you go in and you have like a broken arm and you're going to have to sit on ward for a while you're waiting for your cast, right? They're not going to have you in the waiting room, but you're not ready to go in. Generally speaking, you're going to be in like a long hallway with a whole row of beds with people just like you who are there for gout and are there for to have an abscess removed and it like all sorts of different low level stuff where it's like in an American context, if you've left the waiting room, generally you're expecting to be in a little private room by yourself with your doctor. If your doctor's not there with you, it should still be like a little private room just for you. And certainly, if your doctor's going to come up and poke and prod you and ask you questions, you're not going to have 12 other people sitting next to you. It's a different mindset, and the way that our hospitals are built is to accommodate that.
I
Can't
mean,
just
yeah, like
rebuild the buildings.
I've never had others except for my immediate family in the room with me when a doctor has examined me ever. Right?
Yeah, and again, it's not to imply that they're going to have you drop trow in front of a group,
Well,
a
no,
room
the
full of people. But
military, that was the difference,
well,
but fair enough. But yeah, go ahead.
but if we're talking about like a broken bone, right? There's nothing embarrassing or personal about that. You just need to have, okay, did you fall? Did were you a car accident or okay, you fell off your bike, cool. And how bad is the pain? Give you a little pain chart. Okay, here's some Advil, and the doctor will see you when they get to you. Right? Nothing about that requires privacy, but in a U.S. context, we don't accept that as being something that you can just do in front of a room full of other patients. And again, the way that the buildings are designed is to accommodate that. So if you wanted to have that kind of a system, you would need to address some of those capacity problems. And those capacity problems are in part fueled by the design of the building to give you all these little private cubicles.
Fair enough. Sorry. I know this is a little bit of a off topic. It's not a little bit. It's very off topic, but I want to address this because people have been asking me this all day in various concepts. Rao at Rao, I don't know how to say your name, buddy. Asked me, Wick, did you apologize to Destiny or did you burn the bridge? Neither. I wasn't asked for an apology. The bridge is not burned. He didn't require an apology, right? A lot of people were offended on his behalf, and no, he's fine. He answered my DMs after. He's still on my server. Everything's good as far as I know. If he's mad at me, he hasn't told me about it. So I don't like you guys are trying to gin up this drama. There's no drama there. Sorry, buddy. Anyway, I just wanted to address that real quick. Because it's again something I've been getting a lot of. But yeah, there's no drama whatsoever. At least not to my knowledge. Maybe he's talking shit behind my back. I don't know. But no, it's fine, right? Anyway, back to the matter at hand. Okay, so well, we have a Canadian in my chat saying that doesn't happen in Canada, that they have privacy as well.
And the implication wasn't that there's zero privacy. It was that, in that case, I'm more speaking about the NHS in particular. But there's also going to be, again, the question is, have you ever been in a scenario where you're going to get that kind of a treatment? A lot of times, if you're getting like a physical, right, they're going to look under your shirt and stuff. Yeah. So the question is, when have you gone for XYZ procedure that was to like a hospital network where you would have gone to a ward as opposed to going to a smaller facility, like a clinic? Again, if you're in like a clinic, it's more common to just have the booths because they've got a smaller volume, right? Because you're not serving hundreds of people at a time.
Certainly, but it's really hard, right? We talk about why it can't be the Nordic model, can't be Canada's system, and I take your points, but certainly our system has major problems. You would acknowledge. What are some actual fixes that you think we could advocate for, that could be implemented, that would work to kind of solve this crisis? I guess to start, what would you say are the top 3 issues with the American healthcare system today? What are your top 3 bugaboos with it? Go ahead.
I don't even think I need 3. Just cost.
Okay, cost
I think you could. I think you could address most of the problems if you could get a handle on cost, because addressing cost involves addressing most of those other issues. Right? That it's if one is superordinate to the other, then it isn't as though fixing that lower tier issue is the bigger concern. It's that you can't get the fix to the bigger problem without the fix to the smaller one.
Okay. What
So again, things like pushing younger folks, healthier folks into the risk pools, that's something that would help improve cost. But it's going to involve some kind of carrot and stick to fix that problem of how do you get these people into the risk pools. Dealing with how you handle folks who are experiencing extreme acute illness or expensive chronic illness. If I'm trying to pick my words carefully here. The term they used back in the day was high risk pools. The idea being that these folks who are quote unquote uninsurable, you just throw them all together into a different risk pool and you figure out how to deal with that risk pool, right? You let the rest of the industry do what it's doing because it's doing an okay job of doing it. And then you take all these people who can't access that system and give them an alternative system. And whether that's handled through some kind of fee on the insurance companies or handled through taxation, at the federal level. There's a bunch of ways that you could get there, but that was one way of addressing that problem, right? But the same thing applies here. Addressing this question of how do you handle the uninsurable people, it addresses the cost issue. The cost issue is the issue.
What would you say to those people who say it's a human right, we should simply raise taxes until we can't afford it? I mean, there's an argument there.
Really
you don't want to see Nana dying because she's poor to a treatable illness.
I don't know how I feel about this human rights framing thing because, again, one of the biggest problems is getting the young, invincible people to recognize that they won't always be young and invincible. So there's a real disconnect there that a lot of the people that are framing it that way have no skin in the game. And a lot of the people that are kind of marginal to the system, right? Um, the coverage rate, or I'm sorry, the uninsured rate fell from about 16% pre-Obamacare to about 8% now. But the complication there is that you could have predicted that the uninsurable people would sign up, so naturally there was going to be some improvement there. But we know that that exacerbated cost. And the other thing we know is that about 50% of the reduction in the uninsurance rate came from the Medicaid expansion, which has nothing to do with any of this cost discussion. So we wind
Oh
up
yeah.
back in the same boat where we've driven up costs and we provided people with better access, which is a good thing. I'm not saying that people with pre-existing conditions should be denied care. But when we're talking about insurance, we're fundamentally talking about gambling, right? The product is a casino. Think about any other insurance product you buy, right? If you think about your auto insurance, what do you get for your auto insurance, Wick, right? You don't get some product for your auto insurance. It's that if somebody rear ends you and drives off, you can get your car fixed for a reasonable price. Health insurance is no different. It is a lottery that you don't want to win. And if you take people who are guaranteed winners, which is a weird way of putting it, but again, you think about these folks with the pre-existing conditions, the whole reason they're being excluded from risk pools is because they're expensive. So if we're taking these instant winners and saying that they must have access to the casino, it shouldn't be surprising that the cost of entry for everybody else went up.
It's a hard problem, right? Because no one wants to pay a lot. Especially it's hard to get people invested in paying for someone else when they see nothing directly from it, right? You
Right,
will not
right.
meet the people that your higher taxes or higher fees help. You will most likely never see them, and if you're young, healthy, and live a solid exercise, good diet, etc., you probably won't need uh as much care ever as this. You'll not benefit in the same way until you're very very old. So I'm struggling how to get people to convince that this is something we need to do. Um,
Well,
like
again, I
I
think
don't know.
it's you do it with tax, right? And it to whoever it was who was challenging me earlier, I think something more like the Canadian system is really the direction to move. If I'm being perfectly fair, it's just that I don't think you can do that overnight, and I don't think the ideal solution is to just adopt the Canadian model. I think you retain a lot of the strong private market segments and insurance segments that we have here currently. You just add a some more public supply, not public payment, public supply.
Interesting.
Um,
Okay.
um,
Um. Cool. No,
no,
it's
because
Go ahead.
it becomes challenging to sort of overhaul it that dramatically all at once, right? And again, that's where you get the resistance from the doctors. It's where you have the problems with um, the general intransigence of Congress and things like that, that you can't get these things done. Because remember, risk corridors failed on its own, and then Republicans blocked it in Congress and said, well, the program failed, so we're not paying for it. And then it went to the courts, and then the courts said, no, you actually have to. So, again, to where I'm getting at with the nobody with clean hands, there is a whole bunch of crap that prevents change. And the only way that you're going to get there is by looking at things that actually improve the system for stakeholders involved, right? To your point about uh, getting them to getting somebody who is in generally good health for most of their life to see a benefit in that. Um, it's way easier to swallow a tax than it is to say your general health care, your health insurance is going to be more expensive and will cover less, right? I think that person is going to have an easier time swallowing, well, my tax money is paying for all that, whatever. And then if I have my own private insurance, it's, good in quality and it covers what I need it to, and I feel okay about the price. And this other piece is just something else. I think you're going to have a really difficult time getting the it's especially the youngest cohort to justify a way where um, they are either signing up to insurance they don't feel like they need so that their premiums can go to someone other than themselves, or to extract taxes from somebody who fundamentally doesn't have a lot of income to pay into the system, right? It is going to wind up being a situation where people who maybe are in pretty decent healthcare shape right now need to pay a heck of a lot more in. We didn't talk about Cadillac taxes, but with the or not the auto workers, but the dock workers in the news
Yeah.
recently, that was something that was on my mind. Is that
Explain what
when
that
Obama
is.
so the Cadillac tax was one of the provisions in Obamacare that had to do with employer offered insurance. Because again, when we talk about access, break the population down into your groups. And again, you've got Medicare, you've got Medicaid, you've got employer insurance, you got individual plans, you got uninsured, right? So the employer insurance was generally speaking considered to be the benchmark, if you will. If you look at the medallion structure for Obamacare marketplace plans, not copper, bronze, silver, gold, platinum plans, the silver plan is supposedly benchmarked to a standard private group plan through an insurer, employer rather. So if you work for a big old company, I don't know, Walmart, right, or Starbucks, or fill in the blank, big old company, you get your health insurance through them. They're insuring everybody who works for them, or everyone who works for them that qualifies for insurance. So they have this great big large group, so they can negotiate rates pretty effectively. And the idea was, okay, we want that level of institutional muscle to dictate what you can get in this marketplace plan. Um,
Makes sense. And that's a
Uh,
Cadillac
but you,
tax?
when you look at, sorry, I'm catching my breath. when
Okay.
you look at the unions involved, um, that had objected to this, and again, there's a reason auto worker came to my mind immediately, but um, like longshoremen, dock workers, there were a bunch of unions that it's generally going to be the type of industrial stuff where at least in older days, if you will, there was a lot of putting your body on the line for your job, right? So these jobs tended to come with really, really generous health insurance plans because, if you were working in a factory or in a coal mine, you had different health concerns than your average employee. And that was part of what the union was negotiating for. Well, you look at that compared to the Obamacare stuff, and it was like, well, hold on, hold on, hold on. You guys aren't being taxed for this, right? This isn't being treated as part of your income the way that anyone else's income is being treated as part of their income. But for a lot of you guys, you're getting insurance plans that basically say you pay nothing and you have like a $10 copay for anything, right? Like doesn't matter, right? Could be a cancer treatment, could be a sniffle, $10. Like that's an outrageously generous healthcare plan, and you're not being taxed on it at all, right? Like you guys are living the gold-plated king version of health insurance, and you're contributing nothing to the system for anyone else. So there was supposed to be a provision that would take these generous employer plans and treat this excessive stuff as being a portion of your compensation, right? You think about how we got insurance companies in the first place. It goes back to World War II, where you had wage and price controls. They're trying to come up with a way to entice people that isn't wages. Hey, here's something that doesn't count as wages. But now we're in a totally different world, and the complication is you've given people basically a way to completely avoid the problems that everyone else has in the system, but you cannot. There's no way to compel them to have skin in the game, right?
Sure.
So
No
that
one
was the
wants
goal:
to,
was you
right?
you tax them on this extra crap, but it just never happened.
No, that makes sense to me. That makes sense to me. Okay, interesting. Um, fair enough. So I think we've kind of cut. Well, let me just ask you directly. Would the world be better off, or America be better off without the Affordable Care Act? Should we just roll it back?
I think those are two different questions. I don't think there's any realistic world where you roll it back and don't cause bigger problems than you have now. Um, basically, if you're going to do something about it, you have to like reform it or amend it. Um, Again, in the world of policy, just reversing decisions is generally not a very smart thing to do. And there's a reason that we only ever repealed one amendment to the Constitution, right? Certain things you don't undo it. You come up with a way to make it work. I think that's the reality of where we're stuck now. If you were to ask me back in 2008, 2009, when this conversation was first taking place, if we would be in a better place if Obamacare had been allowed to die in the cradle, right? And instead of putting every ounce of political capital that the Democrats had on the line to get it through at the time frame that they did, I think we would probably be in a better place if that had happened. Because I think if the total package had not been passed the way it had been, you would have been able to come back for another bite at the apple for some of the big things that it did address, and you would have been able to do it in a way that paid respect to what the goal was, or how we were
Certainly, but
supposed to.
you think it's kind of too late to kind of unring the bell, so to speak.
No,
Um,
there's no putting the genie back in the bottle.
got you, got you. Okay,
And again, this is not to imply that there was no benefit that came from it.
certainly.
Um, the ability for someone to get an individual plan is huge, but that's, again, it's a small piece of what that law did, and of the things that law did, that was something that would drive up cost, which is something we've seen manifest. I also think it's kind of crappy that all sorts of people, went out and started small businesses to try to create new engaging insurance options and were completely shortchanged by a system that knew from day one that most of the programs that were intended to support them through that transition period and help them start those businesses were fundamentally never going to come to fruition, were never going to pay out the way that they were supposed to. It's also, again, in terms of abject embarrassment, CSR payments, we haven't even touched on that, are something that once again has wound up in court, because, and this time it wound up going against the ACA because there was no federal appropriation for it. And if you want to add a black eye to the embarrassment, we were sitting there 2 years into the CSR program asking our superiors, how on earth are we going to audit these 2 years worth of data when we don't have an audit protocol? Being told those 2 years are just, if there was fraud, there was fraud. And we're just going to have to hope we get this audit protocol together at somewhere in the immediate term so that we can deal with the current year's data. Because, the more backlogged we get, the more of this we're going to have to just ignore because there's no way we're ever going to unpack it. And lo and behold, that was one of the areas that Republicans attacked it in Congress. They attacked it in the courts. It was a system that was poorly administered from the start. And then Congress never appropriated funds to pay for it. You talk about
And here
places
we
where
are,
the law
right?
has taken its lumps. They have tended to be in the most predictable areas. It has tended to be in the places where it did not take imagination to understand how no risk corridors payments was going to affect the exchanges, how the failure to have an enforcement mechanism for RA with teeth was going to impact insurers in the early days. How many states currently have one insurance option because of that crap? Because every other insurance option dried up. And again, CSR payments go to folks who are getting direct transfer payments. That it's similar to Medicaid, in that it's a payment to your doctor on your behalf. So the fact that you've got this program that is intended to address folks who make too much to be on Medicaid, but who are still getting some kind of financial support, and then not funding it. How do you do that?
It's a good question. $5. Another good question. What should America from the Trib one again? Thank you for the money, by the way. And gang, if you've enjoyed this content, if you like this content, hit that like button, hit that subscribe button. I know it's dry. I know it's wonky, but I think it's worth discussing. So thank you for the support. Thank you for watching. I really appreciate you. $5 from the Trib one. What should Americans do to get more educated on the healthcare system? Is it as simple as talk to individuals in each field?
To get educated on it. I really think that there needs to be better consumer advocacy, is probably the way I would put this. I think
Can you elaborate on that? What
there's
do you mean by consumer advocacy? Go ahead.
well, I think there's interest groups for the doctors themselves, right? I brought this up when we talked about the naked threats that were being issued about, like, doctors are just going to retire if you don't pay them right. Um, that uh, they're individual people who go to their doctor, don't generally speaking have an industry group that says, hey, somebody might need to help you navigate talking to your insurance company or dealing with a claim or an appeal. Nobody is going to help you figure out how to assess who is the best doctor in your area, or whether the doctor's prices they're charging are reasonable. um, and sure, a lot of that is going to boil down to like personal factors, right? Whether or not you click with your doctor and things like that. But it's certainly fair to say that if you move from one city to another city, you don't necessarily have a good barometer for how to go about picking a doctor. You don't necessarily have a good barometer for how to go about picking a new insurance plan if you move to a new state or to a new employer with different options. These are things that you'll get the sort of standard HR. Oh, here's a pamphlet on your
Yeah.
options, but there's nobody who's ever going to actually sit down with you and talk to you and
I
help you
think
figure things out. And I think that having a some umbrella
uh,
organization like that, like the AMA, that could say, here's our pamphlets that help you understand how to navigate this, that would probably be a really positive
this
improvement.
is one of those things where I think that there is an organization that we have in America that could at least somewhat address these inadequacies and these ignorances. That's the education system. I think we need perhaps a mandatory kind of life skills class where you learn how to deal with taxes, how to deal with insurance, how to navigate these systems. That
You realize that
we rely on families, friends, and experience to teach that, and I don't know if that's wise. I think that having some kind of mandatory life skills course where you have to pass, and they have to educate you on, okay, this is how we deal with insurance, right? And I know that's hard. I know that's a tall order because it's a complicated topic, right? Even adults have problems with it. But I don't know if we want a consumer kind of advocacy kind of thing. I don't know how else to do that. Does that make sense?
it does. But I'm always a little surprised when I hear this thing about that type of class, because I don't know if you were aware of this, Wick. You and I are roughly the same age, and I had to take several classes like that in high school. Um,
I took a
like,
couple, but
and I say several, it was more than one.
yeah,
And
I took a couple, but they were poorly done. I learned how
I
to
don't know
write a
about that.
check. I
I
learned
think the
how
challenge.
to right. I learned how to do like super basic stuff, but again, we never went through how to do insurance. We just never did.
Well, sure, but I think the bigger problem is that it's difficult to teach that kind of stuff to kids at that age because it's too abstract, right? For kids at that age, because we're talking high school, right? Um, if we're talking about education system, we can't be talking college level because not everyone goes to college,
Yeah,
right?
it has to be high
Um,
school. I would say probably
so
starting at the junior year. You
But
should have to have something.
the problem is that kids at that age, generally speaking, a lot of them haven't had a job yet. If they have, it's probably literally their first job, and it's like McDonald's or something. Not to disparage that, my first job was at Arby's, but like that's very different in
7-Eleven
terms of
here. Okay, so go
yeah.
ahead.
But you know what I mean. It's very
Yeah.
different in terms of your level of responsibility, how serious you take it, and again, things like taking care of yourself or buying health insurance. At the age of 16, 17, that's not something that's on your horizon, and it's not something that you can bring onto a teenager's horizon by telling them that they need to think carefully about it, right? Like we all
I
know
get it,
that like
but
you don't tell kids that doing drugs is okay, but we all know that telling kids not to do drugs doesn't prevent it from happening. You know what I mean?
I
Like
get
there's a
it.
certain amount of teenage brain you can't get around.
Uh, Indeed, I'm again. I'm not suggesting it would be perfect by any means, or there wouldn't be flaws, or wouldn't be. It might be even just kind of like uh, a drop in a very large bucket. But if that is one of the issues that you are kind of alluding to when it comes to our healthcare system, I mean, we already have this in place, and I can't think of a better way to mandatory, right? Because education system in the U.S. is mandatory than to have that kind of thing taught on a federal level. You mandate you have to have some sort of education on this, right? And you have standards and develop a course curriculum, basics, and things like that. I don't know.
Well, I think the reason I'm pointing to like a consumer advocacy type of approach is that you can meet people at the levels they're at currently, that as you improve the system, some of those metrics should change and shift over time, right? That if you are drawing people into the system early, then you are seeing improved prevention and reduced costs through that type of early detection type of behavior. But you're also dealing with, folks who are in their 50s who are trying to figure out what they're supposed to do as they're getting ready to retire and, navigate Social Security and Medicare and things like that. That you can put together a more comprehensive approach that when you're looking at how you would message that to kids, I'm going to say kids, the young cohort that are healthy that we're trying to drive into the risk pools, the way that you're going to motivate them is not going to look the same as the way you're going to motivate somebody who's already
I
in their
don't. I
40s
don't think we
and
can
needs to get a
motivate. I
colonoscopy.
think we have to, and this is going to be one of my more authoritarian takes, right? I think you have to mandate it. I think you have to put teeth on some sort of system that requires, do you have a job? Then some of your money is going to go to this system. Um,
Like a tax.
yes, it has to be. And I know that's very hard to pass, very unpopular. It absolutely, I get it. But if we want to fix the system, one of those things is, as you said, we're going to be required participation within the system. And yeah, I don't see how we can get around that. Maybe I'm just a silly boy. I'm just a streamer boy. I got streamer brain. I'm not the smart guy. Okay. But I just can't think of a way around that if the goal is to drive down costs for the majority of Americans. I don't know.
Well, again, I'm here saying that I think a tax and a more public system is an appropriate and
Yeah.
adequate response to the current situation. You're not going to hear me argue about that. I said I think it's harder to get someone to swallow the idea that the cost of their health insurance is going to go up or it's going to cover less, as opposed to telling them your health insurance is going to stay exactly the way it is, but we're going to tax you and we're going to use that tax money to help pay for people who are sick. I think that's a way easier sell
Yeah.
than the
But it's still a
product
hard
that we're
sell,
compelling you to
right?
buy.
Yeah, the thing, like, people forget, like, here's something I hear all the time, right? That, like, oh, everyone thinks that the American system is so poor, it's so bad, it's so awful. But when it comes time for votings, they vote for the people who want to maintain the system as it is, right? Like, the people who say, yeah, we're fine, we're okay. Like, Trump won, right? Trump won. The Republicans won. The Republicans won for the most part, and I know I'm being a little, I'm kind of being a little bit generalizing here, but for the most part, they think we have a good health system, and they want to keep that health system, and a majority of Americans have voted for that health system. So, right, like when we come to like solving this problem, most people don't think there's a problem to be solved, right?
Well, it's interesting you raised that because one of the reasons I kept saying that you got to think about these different buckets of people, right?
Mm-hmm.
We said about 16% of the population was uninsured when Obamacare was first passed. 16%, right? That means that 84% of the population was insured. Um, and when you talk to people who have various types of healthcare provisions, surprisingly, a lot of the people who are happiest have some kind of government plan, like veterans benefits or Medicaid. Those actually tend to be the people who are most satisfied with their healthcare coverage. Um, and when you're considering again that 16% slice, and remembering that in that you've got people who are refusing to sign up, people who can't sign up, and people who uh, would sign up if it was more financially viable. That's we're looking at small slices, and I don't think Obamacare was really targeted at the slices that it needed to be best targeted at. I think it basically just took the folks who needed the help, lumped them in with the private market, and said there you must provide them insurance. But didn't fundamentally do much of anything for people who needed the financial kick.
Yeah.
Especially when you look at half the gain coming from Medicaid expansion and knowing that donut hole is still there. Because not every state expanded Medicaid, and if you could be in an even worse situation depending on what state.
It's a complicated issue, and it's complicated to talk about. It's complicated to talk about fixes. It's something that a lot of moving parts that need to be addressed. And there's, as you said, competing incentive structures for everyone involved, for the consumer, for the provider, for the insurer, for the government, for um, uh, the federal government versus the state government versus the local government, right? And in no matter how you slice it, someone's going to be unhappy. In fact, a lot of people are going to be unhappy if you change the system. And that shouldn't mean that we don't change the system. I do think that insurance, health insurance in America is failing the people. Um, but just in case you crazy kids get ideas, Luigi failed even harder, right? Vigilantes and those cheering it on are more responsible than health insurance are. You are going to indirectly cause more death than any CEO of United Healthcare or whatever, right? So quit doing that. Okay. Is there anything else you wanted to address with this regards to this topic? Anything you else want to talk about with regard to insurance or anything like that?
I mean, I could drone for hours, but I'm sure I'm on a certain level it gets boring and
Well, I
repetitive.
mean, that's the thing is there's I just like we've talked about a lot of the flaws in the system. I'm sure there are more, right? I don't know if we have time to go into every single one. Is the
No,
issue,
and
right?
I don't think there is. Again, I think from my perspective, the kind of the big ticket items that I wanted to sort of put out there was the degree to which it was obvious that some of the provisions in the law were designed to fail, or
Yeah, yeah.
were designed to never come to fruition. That for a it was more than one law technically, but we'll call it a law that had two goals, right? That's kind of a really poor outcome or performance to say that when we wanted to improve access, we were only able to roughly cut it in half. And among the folks who you would think would have been like most affected, who would like instantly sign up, we're talking very marginal 4% slices of the population. The other half didn't get any redress at all. And then in terms of addressing cost, arguably we made things worse. Um, so I
Yeah,
think that's a pretty lousy outcome
it is.
to
It
achieve.
sucks.
And when you hear people criticize Obamacare, you're going to hear mostly, again, ultra righties and conservatives and folks who want to, win some kind of partisan argument. And realistically, I'm just here saying like we didn't do the job we set out to do.
It's frustrating because one of the problems that the Democrats have that I have, because I am a Democrat, is people don't trust us. And one of the reasons they don't trust us is we are unable to acknowledge when a program we have created has huge flaws. I hesitate to say it was a failure simply because I think that the before times, right? There were people in my life who could not get insured that now do have insurance, and I can't call that a failure, right? But it did have glaring problems and introduced new issues into a system and exacerbated some issues in the system where I could see where we needed we needed something else that didn't work in what it was designed to do. And I think that until we acknowledge these facts, it's going to be hard to get anyone to trust us, to vote with us, to kind of give us another shot. And that's an unfortunate thing, right? People are asking me like about my insurance. So I get I get medical care through the VA. I'm a veteran, right? The VA sucks, gang, right? I am not satisfied with my level of care. It sucks. It doesn't cover dental. It doesn't cover a lot of things, right? If I have an emergency or something, I can go to the VA. It won't cost me anything, but it's not great care. And yeah, I don't know what to do about that. So Rabid Wombat says, when are you ever gonna need dental though? That's a funny. That's a funny. You made a funny. But yeah, it's a problem. Health the
To be
healthcare
fair, though,
industry is
dental and vision are two specific areas that aren't covered under the same insurance for.
yeah, yeah.
It's basically, again, it all has to do with cost and risk.
Yep.
That essentially, especially like dental's the real good example. If we're talking about like making sure your teeth don't fall out and you don't get a heart attack from having like rot in a in your dental canal or whatever that's like then going to your heart. That's all very manageable stuff. You just go in twice a year, get your teeth cleaned, no big deal. So that there's kind of a reason that that's on its own separate
Absolutely.
side of the fence. Same thing again with vision insurance. That generally speaking, you go in for a couple of exams periodically, and you just don't have extra costs.
What is your thoughts on the Luigi thing, by the way? I don't think we've ever talked about that. Luigi, we had a show on that yesterday. Well, I guess to just, how do you think the show went yesterday? Did you watch it?
I watched some of it, yes.
Some of it. Okay, what are your thoughts? Come on, hit me with it.
I don't know, man. I find it hard to believe that anybody would be willing to take Luigi's side on any of it. Like, it is very difficult for me to wrap my brain around the concept that you can I guess like I've got some friends who have more or less expressed something along the lines of like, why do you expect me to care? And I like on some level I can get that like, oh, someone was murdered across the country, like in a city and state I don't live in. Why do I care so much? Like that I can jive with that. But to go like a step further than that and be like specifically, yeah, he should have died, or like Mangione was doing some kind of positive action or anything that isn't just a deranged psychopath committing murder, like that to me is several bridges too far.
Yeah, it's unfortunate because it's hard to get a. And I was telling my audience this before you came on. There's, whether it's true or not, there is this idea that if you simply give your honest thoughts on the issue and it's positive towards Luigi, you will get banned or violate toss or somehow get dinged for that. I don't know if that's true or not, but enough people believe it to be true that it affects their judgment. And so when I had the guests on yesterday, there was way too much throat clearing because I knew their positions, right? I knew what they thought. Um, but they kept trying to make it more. They had masks on, okay? Let's just say that. And it was hard to kind of get to the meat of the issue. And this is just frustrating. It was a frustrating conversation. It was a frustrating show. I didn't like it. I'm going to be real with you. I thought it was one of my poorer shows, but it is what it is. It is what it is.
I'm all I can say on that is that from having been on the other side of Twitch, the gaming side of Twitch, trust me, there's plenty of people who do the same crap over there when there's a whisper or a hint of something being against Toss. So that's
I get you.
sad,
Yeah.
but not surprising if there
Yeah.
was a concern that there may have been. I'm thinking of a
No,
previous
I
panel I was on
understand
where
it.
someone got
Yeah.
ejected.
Okay. Well, yes. Sometimes you gotta do what you gotta do, but I think that
Well, but that's relevant because
it
I
is.
believe we ejected him for something largely similar to.
Well, and everyone understood why what he was saying was undefensible. But for whatever reason, they think it's this too. I do think that vigilantism and people's lauding and celebration of vigilantism is a real problem in America right now. And I don't know how to fix it. I don't know how people. Maybe it's because I grew up on stories like the Count of Monte Cristo and other such tales of revenge and why revenge was actually cancer to the person seeking it. Um, Nowadays, we have revenge porn in movies, right? Where you go out and it's about the guy someone does something wrong to them, so they go like John Wick, the John Wick movies. They killed his dog, so he goes on a rampage and murders like all of them, and we cheer that on, right? Wick is righteous; they are villains, and we get that to some degree, but it's a movie, right? It doesn't deal with the realities of how these things would play out in the real world. And I think that people have it has become harder and harder for people to separate fact from fiction and fantasy from reality in a way that I find disturbing. Yeah. Yeah. Okay, anything else?
No, again, I appreciate the opportunity
Of course.
to bore your audience.
Some
Um,
people enjoyed it. Look, Solemn Argus liked it. The Trib One loved it. He's the only one chatting in my YouTube chat, and yeah, everyone enjoyed the show that's still here. But do you have a channel?
it's
They're
still
asking
here,
you.
yes.
Yeah. Do you have a channel or anything?
My routine sign off at this point is if you want to follow me, I'm at Principles BP on Twitter, but I don't have anything to sell, so only follow me over there if you actually really want to hear me talk about shit. Because half the time I'm talking about video games or Dungeons and Dragons, and the other half of the time I'm pretty aggressively talking about policy and politics. So
There you go. Well, I appreciate you coming on. I appreciate you having a conversation with me. I enjoyed it. Thank you.
yeah,
I'll see you
appreciate
later, buddy.
the chance. You have a great night, sir.
You too. What a good conversation, gang. What an interesting healthcare is a large topic. There's a lot of ways to tackle it. One of the problems is people are trying to, and I get why they're doing it. They're trying to make it more digestible, and they're trying to shorten it, and they're trying to put it into sound bites. They're trying to put it into something they can package and they could sell, that they could to give to the public, that they can more easily digest. 99% of the people attempting to do this are failing to do this correctly. And it is making the conversation harder, and it's making people more ignorant to the facts of the matter. It's one of the reasons why today, even though I did somewhat attempt to kind of cut to the chase in some instances, it's just important to go through the nitty gritty, right? It's important to go through like an hour sitting there learning what all the moving parts are of this one aspect of healthcare. And I'm sure I didn't do it perfectly, right? Again, I'm not a genius here. I got streamer brain. I'm a streamer boy. I'm not a health insurance expert by any means, but this man worked on the Obamacare. So if anyone knows what they're talking about, it's him. Okay, Psychor. What is so Raw says he hated it. Snack companies have to be taxed and weight loss drugs should be covered. That's the solution. This is okay, when we talk about simplifying, this is what I mean. No, that's not the solution. That's part of a solution. Certainly, these are good things to do, but doing that isn't going to solve our issue, right? There are far more other factors at play than just those things, and we have a tendency to want to do this. We want to reduce things down to, well, all we have to do is X, Y, and Z, and then it's good. We're fine. We're all gravy, baby, and that's just not how this works, right? Health care, health insurance, health providers are so interwoven and interconnected. There's so many Byzantine rules, regulations surrounding this issue that you can't. It's a Gordian knot. You can't. There's no simple solution here. You can't. You can't just cut it in half, like Alexander the Great did. Right? You actually have to kind of sit there and tug at it and figure out a way to make it work. And that's the thing. Like, depending on who you are and how you interact with it, the healthcare system in America may absolutely be working for you. And people try to universalize their own personal experiences with it, right? They'll be like, well, it worked for me, therefore it's good, right? And I'm sure you guys are just outliers. On the other hand, they'll be like, well, I had an issue with it. Everyone else must have the same issue with it. And because this issue exists, even if it only exists for like 0.001% of the people who use it, thus means it's a failure of a system. None of this is actually true. Psychor for $2. What do you think of my thought experiment? Let me read it. I'll get it to you. So your thought experience, it says, ask them if they'd feel the same about Luigi if Ben Thompson was a woman. Instead of killing, Luigi R-worded Ben. Rabid Wombat actually asked this. And yeah, I mean, it would be hard. You know what? I think that a lot of people would still say, yeah, they get what they deserve. A lot of people are just cruel. A lot of people just want vengeance. That's it. So Yeah, it'd get some of them, but it wouldn't get all of them. Look at people's response to October 7th and how many people were willing to excuse the R words, the graping that happened there because they thought, well, Israeli deserved it. So yeah, I don't think you get too many. Um, Jesus, yeah. It's just unfortunately there is a large overlap between these two groups who think that October 7th was justified and Luigi was justified. There's it's a Venn diagram that's almost a circle. It's not entirely right, but it's pretty close, and that's fine. You got the name wrong. It's okay. Um, Old School says hi, Wick. Hi, Old School. We're not doing much today. We don't have much more to go. Again, today was wonky. I know. We had a guest who worked on the Affordable Care Act, Obamacare, right? We had him come on, talk about the ways he feels the system has failed, and went into the nitty gritty on a little bit of it. Again, hard topic. Not something I feel comfortable saying I did a good job on. I don't know if I did, right? But we try. When we talk about getting educated on these things, I think it is important to educate yourself. I think it's important to find a way to understand the system better than we do. And I include myself in this too. I want to understand because, again, I deal with insurance in a way that is different than other people because of my military background. And I have coverage through the VA. So I do not engage with the system like someone normally would. It's a different experience for me than it is for everyone. But that's the thing with health insurance is it's almost everyone has unique qualifications. I won't say unique, but qualifications to their experience that makes it abnormal. Does that make sense? $5 from Trib One. When Civil War Part 2 happens in 3 years, healthcare will be cheaper. We'll just have the losers, cringe rightoids, pay the difference. Yay, ye 2028. Okay, maybe. Thank you. Thank you for the $5. I do appreciate it. Rabid Wombat says, I think the grape thought exercise would work better if you keep it to 2 men. Would it? Probably. And Trib 1 says, starts with believing that most of the people involved are honest and good faith actors. That's step 1. Till then, I don't think any amount of education will change your point of view. Fair enough. Rabid Wombat says, perhaps atypical rather than abnormal. Fair. That's better word choice. Atypical. There are so many different Byzantine regulations. There's people get their insurance in different ways. Different companies offer different insurance options. Some don't offer options. This is your plan, right? But there are many companies who offer different levels of coverage that people can choose. Some people don't get insurance through their corporation or their company. They get it through other means. And yeah, it's a real Gordian knot, as I say. So did you guys like yesterday's show? I hope you did. What else do we got coming up this week? Tomorrow I might not stream. I might have a call-in show. I don't know yet. Wednesday we're going to talk about the H-1B visa program. We're going to have some interesting individuals who are supporting it and think we should remove some of the caps on H-1B visa limits, or at least extend those caps. And there are others who say that the H-1B visa program needs to simply be reformed entirely. It has too many issues, too many problems, and we need something else. So it's going to be a fun conversation. Tune in Wednesday, 6 p.m. Eastern. It will be good. Rabbit, you're free to join us if you'd like. Rabbit is anti-Testy in this, as he is in most things. Testy Johnson versus Rabbit Wombat would be a funny little debate. Thursday, we got a one-on-one debate I'm hosting between Portland is Burning and Quibbles Over Coffee. And they're going to be debating, okay? They're going to be debating whether or not it's homophobic or biphobic if a woman refuses to date a bisexual man. Is that homophobia? Is biphobia at play in that decision-making process? We're gonna find out. It'll be fun. You might as well check it out. Depends on her reasoning, to be honest. I guess we'll find out. Nair Sock says yes and no. Trib says also yes and no. See, yes and no doesn't make a like. What do you mean by yes and no? Maybe elaborate a little bit. Maybe I'll agree with you. Let's find out. Portland is burning says I will win. What's your position again, Portland? Remind me. I know one of you says it is, one of you says it isn't, but I forget which one of you is which. I'd have to look at it again. Portland, are you is it biphobia for a woman to refuse to date a bisexual man? Portland says it is. No, that's the deciding factor in Iron Socks. That's the thing. A woman finds out a man is bisexual and says, "You know what? I'm not going to date you anymore because I think you're I think I just don't want to be with a man who slept with another man or had sexual relationships with another man." Is that preference or phobia? The Trib one says reality is bisexual, doesn't really exist. Oh, that's a spicy one. That's interesting. Okay. I think it does. I think I know bisexual people. I'm not, but I know people who are. I think they're real. Nair Sock says, is dating a man who is straight versus bi different? I don't know. I've never dated a man, straight or bi. Betsy Johnson says, if she's like, ew, you had poop on your dick, it's bigoted. If she's like, I'm insecure and don't want competition from 100% of other people, then that's fine. Interesting argument. I guess we'll find out. Okay. I'm trying to draw it out so I can raid into Prime Kai. I haven't raided into Prime Kai in a while, and I want to raid into Prime Kai today. So I know he doesn't go live for another 20 minutes, so we're gonna keep talking for another 20 minutes about various different topics, various different things that are coming up and that we need to discuss. The unfortunate part though is we've kind of hit the highlights of what's going on in the world right now. We are kind of like in a wait and see mode, I guess, for the Trump presidency. Trump will be inaugurated on the 20th. Until then, we're kind of just guessing on how his presidency is going to run, and we just kind of we need to see. We can look at the hints, and we can look at the various statements he's making, but until it actually happens, it's hard to really make any concrete predictions. I'll say this, that the schism between Elon Musk MAGA versus other MAGA has been interesting to watch. As an outsider, look, I'm always involved in the leftist infighting, okay? You're in it to win it. You take your sides. But this is something where I think, first of all, Elon's just correct in his assessments here. But it has been interesting to see his reasoning versus the reasoning of other MAGA. And again, just from statements that I've seen made, it seems to be that J.D. Vance sides more with other MAGA, whereas Trump's made some statements that are directly saying, no, Elon's correct. Now, this is a reversal of Trump's old position on H-1B visas and things. He has put limits into the system, right? So we'll see, right? We'll see. Gelatinous Rube says, how's it going, Wick? It's going, man. Like, we're here. I don't know. It's like It's hard to judge. I'm in a weird position. It's not yet the new year. Christmas is over. And again, I'm in wait and see mode. I'm in hover mode right now. Right? Do you guys have here's this. What are you guys' New Year's resolutions? Do we still do that? Do we still do New Year's resolutions? Is that a thing that people do? What are some of your resolutions, gang? What are you resolved to change about your life in the year 2025? What are some of your resolutions? I have goals. I don't know if I have resolutions, but I have goals. So for the following year, in regards to my channel, my goal is to double my sub count on YouTube. I've plateaued. Okay, I've been around the sub count for a few months now, so it's a heady goal, but it's something I want to do. I think I got like what 6,000 subscribers right now. I want to change that to 12,000. Right? I think it's doable too. Look, my content's pretty good. My content's pretty good. At least compared to, and I don't really watch other people, but I'll check every once in a while. Right? I'll just kind of like do a compare, and I'll look at what other people are putting out, and I'll look at the quality of live streams that they're doing. I'll look at the quality of content they're doing, the quality of conversations that they're having. I don't think it's vain to say mine's top tier. Mine's better than 99% of them out there. It just is. Even some of Destiny's conversations that he has, my conversations are better. They just are. They're more interesting. They're more engaging. We get to the root of the issue better. We have more back and forth. It's more honest. It's more genuine. Usually, not always. And that's not to say all my content's winners. It's not. Like there's some shows that just go poorly. I think yesterday was a poor show, by the way. That to kind of compare and contrast. I know a lot of you liked it. I wasn't satisfied with it. I thought it was one of my poorer shows. That's it. Yeah, I just think I don't know. And so I do agree with Testy Johnson saying I need edited YouTube content because that seems to be the difference. Other people have regular edited content that gets out, whereas for me, it's kind of a chore to find my streams. Like you have to be subscribed to know I'm going live, otherwise it doesn't get pushed out. It doesn't go to the algorithm. It's just not there in the algorithm. And the fact that I have as many viewers as I do, not being in the algorithm, I think is a testament to the quality of my work. But it is what it is. Rabid Wombat says, when faced with an opportunity to procrastinate, I must not procrastinate. I think that will make a major difference in my life. Fair. Portland is Burning says, yes, you desperately need to play the system better. LOL. TikTok clips of your debates would be a good move, too. Yeah, absolutely. Look, 100%. You were correct. You guys are just right. Cal says, not sure how you make the sausage behind the scenes, but if I had to guess, it's probably about gaming the algorithm. Yeah. As I said, I don't release videos, right? I don't release clips. I don't release anything. There are no shorts on my channel. There's like 5 shorts on my channel for the entire 2 years. A year and a half. I've been streaming on YouTube. There's like 5, maybe 6. I don't get clips. I don't have people going out making clips of my stuff and putting them on TikTok or putting them on Twitch or Twitter, right? I just don't have that. I know that a lot of people do. A lot of people have people that will. Destiny is a good example. He has a team. He has a team that will take opening statements he makes, clips he makes, statements he makes, and they will paste them all over Twitter, paste them all over the others platforms and things like that, and yeah, gain real traction that way. I just don't have that, and that's it is what it is. So I need to do better on that. I need to figure out a way to balance that, because one of the problems with it is, one, I'm not good at it. I've tried. I'm just not good at it, making those clips and those edits and things like that. 2, my effort and energy I put into my work goes into the actual conversation, which is why, in my opinion, my conversations are better. My effort, my research, my energy all goes into kind of creating the content, but presenting the content, I just don't got nothing, right? And I just don't. I could put more effort into that, but then the content quality would suffer. It just would. That's why a lot of people who have these things, most of their content is React content. Like that's all they do. They have the occasional conversation, but most of it is just watching other people. Which I don't know, man. I don't find that entertaining. Yeah, most of my content is more panels. I would love to go on more people's shows. They just have to invite me, and maybe I should be more. That's a good idea. Maybe I should. I have perms in Destiny's channel. Why should I just jump into there more? Right? Maybe I should just invite myself more onto other people's content. That feels weird to me to do though. Like it feels like I'm intruding. Does that make sense? Feels rude, which is ironic since I encourage other people to do it to me. I encourage other people to do the same to me, right? Who else is really doing panels like these? Prime Kai, Luffy Water Kai, Admiral Gibbs is trying a couple panels. He invited me on one. I can't think of anyone else. Not off the top of my head. But again, I don't really watch other people. Not really a lot. So. Rabid Wombat says, if you think you have better conversations, why don't you go have better conversations with larger creators and get some exposure? Good idea. Like I said, I have these perms, but I feel it's rude to invite myself. That's a personal peccadillo that I need to get over. You're correct. Wick, do you know the verbal combat crowd? No, I have no idea what those are. Cal says, I originally found you through Destiny, what feels like years ago. Yeah, a lot of people did. Need a separate channel and upload full mods, edited or not edited? Fair. And the reason I know I have better... Look, Rabid Wombat, the data I'm using isn't just my personal preferences, which are obviously there, but the fact that I, a small channel, can get large creators to talk with me and to engage with me, right? Because they enjoy it more so than they do going on these other shows where that has like orders of magnitude more viewership than I do, but the conversation just isn't as interesting. So yeah. Yeah, no, you're right. Rabid Wombat, you're just right. You're just correct. I can't argue with that. You're just correct. That's true. Frost back asking questions says Sitch has a good view of it with the dive he did into the stats. I've invited Sitch and Adam on the show. They don't generally say yes. They said yes once. Sitch had jumped into the show before, but they generally don't. They're busy. They got their own thing going on. So I do like watching them on occasion, yeah. I know they get a lot of shit for being centrist or whatever, but I like them. I don't agree with them on everything, but I enjoy them, yeah. And this is another problem I have with the culture in this space. One of the real big issues I have in politics in general is that we see each other as competition and we see each other as enemies. And I think that's hurting us. I think it's hurting the content just from a selfish perspective, right? And I think it's hurting us politically as well. It's making it really hard to actually get anything done because you can't give those infidels an inch, right? There can be no compromise with fascism. Or if you give a communist an inch, they'll take a mile, right? And how are you going to work with someone that you believe is going to destroy the country, right? Cenk Uygur, I'm trying to get him on my show. I'm trying really hard because I want to have a talk with him. I am more sympathetic to his way of doing things than 90% of the creators that on the Democratic side. That's not to say I think what he's doing is perfect or that I think he's going about it the right way. I don't. But I get what the concept is. I get that, and I actually agree with it. I agree with the concept of going on to into very right-wing spaces and having an honest conversation with them. That's good. I wish he did it better. But no, it's a thing where like I'm so sympathetic to it. I'm so sympathetic to it, and I just see so many people calling him a traitor for doing so, right? Like Pisco's on this fucking crusade about it, right? Pisco's like burn the witch, because Cenk's going on these shows. I just want to have a talk, okay? So I'm pulling my strings I can. I have some connects. I'm trying to get it done. One of the problems with the whole situation is that it is New Year's and it is the holidays, so it's harder to get a hold of my connections who have connections to these things, right? Because they're with their families. They're busy. It's the holidays. So that's been it's kind of put a little bit of a damper, okay, on things. But yeah, it's just so fascinating to me, and I see Cenk going on these other shows, these bigger shows. He went on recently with two people. I forget the first guy's name, but the second guy runs like the Bituation Room. I forget her name, but she's been on Piers Morgan a couple times. And she just excoriated the guy, right? Excoriated Cenk. And I feel like he's being burned at the stake. Not as badly as Jesse Singal, okay? But he is. And that is a warning sign, in my opinion, for the health of our democracy and for the health of Democrats in general. Franny, is that her name? Thank you. Okay, I appreciate it. I'm very terrible with names. That is a warning sign for Democrats' future. Okay? The fact that anyone who is going on these shows is being treated as a witch to be burned. And again, Cenk is not doing it the best. Okay? I'm going to be real with you. I have some problems with how he's doing it. I'm not here saying he's doing it in a perfect way. He is not. Okay? Please don't take that from what I'm saying. But I think that people are being way too harsh on him. Mark says, is Destiny being blackballed? I haven't seen him on anything big lately, and I really identify with a lot of his takes, but he just loses it. I don't know if he's being blackballed. Obviously he's banned on Twitch, so you won't see him there. But no, I haven't blackballed Destiny, and neither has anyone I know that would normally platform him. But I don't know. KTC says, Cenk's strategy, go on right-wing shows, crap on Dems. Wick, why is this good? Again, if your takeaway is I think Cenk is doing this correctly, he is not. Okay, let me reset. Let me try again. Let me see if maybe it's me that's communicating poorly. That's always a possibility. I am not the best communicator in the world. I make mistakes. I tend to be a little too long-winded, etc. Let me try again. Okay? I think that Cenk's concept of finding places where he agrees, right, with people who are in power, going on their shows, trying to advocate for the things he agrees on, right? The things he wants to see done, and works with the right wing in order to get that done, is good. For example, if President-elect Trump, right, if he said, I want to abolish the Electoral College, I would be like, I will make sure that I will help you. I will help you so that happens, because I also do not like the Electoral College. And so we both want this thing to happen. Let's work together to make it happen. Yes, Trump, I don't like you. I think you're a bad person. I didn't vote for you. I'm not going to vote for you. But on this policy, we happen to agree. And so we can work together to get this policy passed, because I want this policy passed and you want this policy passed. Hooray. Let's do that. Okay? I think part of that process is going into these right-wing spaces and acknowledging, hey, we have some things in common that we want done together, right? And these are the things that I think we can work together on. Again, I think Cenk gives up the game too much. I think he, again, as you said, shits on Dems more than they should be shit on. And, frankly, a lot of the things that Cenk wants, I oppose. So, right off the bat, we would have different policies that we would agree on, that we would work together on in these spaces. Right off the bat, that's the truth. That's the case. But the whole concept of finding points of agreement, going on to these shows, highlighting the agreement, working together on the agreement to get things done is a good thing. It's a good thing. $5 from Old School says, being on the right, I mostly watch left streamers. Most lefties are nuts and entertaining, and I can make better arguments than most right-wing streamers. Fair enough. So, KTC, what is wrong with that? What is wrong with that? And again, like I said, Cenk, while I don't think he's doing it correctly, the concept is a good one, and I think we should encourage it. And I don't like. I just don't see. I don't see that as a problem. I see that as a solution. KTC, again, I think Cenk does it poorly. But too many people are saying too many people are burning him as a witch for doing it at all. Whereas if someone gets up and he tries to speak and speak another language and they butcher that language, we could say, man, yo, yeah, you did that incorrectly. You mispronounced these words. You got these words wrong. You didn't have a sufficient vocabulary, etc., etc., etc. But we shouldn't criticize the guy for trying, for getting up and making the attempt. We should say, no, it's good that you're trying to speak another language. It's good that you're trying to learn this language and communicate in another language. That's a positive thing. You're just doing it incorrectly, and we should change how. Does that make sense as an analogy? Tessie Johnson says, I think the issue is Cenk used to be super lefty. His move to the middle is burning his core audience. That, maybe. Look, I can't speak to that as much. If he's actually changing his positions, fair enough. Though, to be clear, if I find out I'm wrong in a position, I will change my position. I don't think, like, someone should be afraid to change their positions because they'll lose their audience. And I think far too many people are, to be clear. I think that there are far too many streamers out there, right, who are afraid to disagree with their audiences. Luckily, I'm not one of them, as you guys know, right? As my audience here is aware, I have no problem calling you dumb and stupid. And I have no problem with you calling me dumb and stupid, right? We have that kind of relationship. But there are so many streamers out there who won't, who, and I've talked to them in real life, right? I've engaged with them, and they'll say things like, "Well, I can't work with this person, or I can't cover this topic because if I do, it will hurt my brand. My audience will rebel." Is what that translates into. And they are held hostage by their audience in a real way. And I get it. No, I get it. Like, if I had just towed the line on all sorts of opinions, right? If I had just taken the bog standard positions with very minor differences of pick an ideology, any ideology. If I just did that, I would have more a larger following. I would, 100%. But I don't want to, because I don't believe that. I'm allergic to lying to my audience in a real way, right? It catches in my throat, right? Like, I can't tell you something that I don't actually believe. I can't advocate for something that I don't actually think. I just can't. And a lot of people don't like that, because that means invariably we'll come to a disagreement, and I think your position is either evil or retarded or harmful or whatever, and I will simply say that. And a lot of the feedback I get is like, well, no, that's the right-wing position. I don't care. Is it the correct position or is it the incorrect position? That's all I care about. Not if it's right-wing or if it's left-wing or if it's centrist or whatever, libertarian, communist, whatever. Is a position correct? Yes or no? If I believe it's yes, then I will advocate for that position. It's that simple. But that's death for the algorithm, gang. Because that means, again, I am not an ideologue. I have different beliefs and different values that there is tension, right? And sometimes I value things more in one way, and sometimes I value things more in another way. That's going to create a heterodox series of beliefs that I have that do not line up perfectly with any other ideology, right? Now, most people also have this, right? It's just a naturally occurring thing. But when you are a streamer and you're presenting these things, a lot of people ignore their heterodoxy and simply tack on to the orthodoxy of whatever their audience seems to feel, okay? And they will run with that, and they actively suppress their heterodox beliefs. Or if they allow some to come up, they allow the safe ones to come up, okay? Now, again, it's a spectrum here, okay? Everyone's going to have disagreements, but there are disagreements that are allowed, and there's disagreements that are disallowed. And it's incredibly nuanced, but at the end of the day, I'm just going to say what I think. A lot of people, well, and this is another thing. A lot of people, they get in these social circles, and they're scared to go against the leaders of their social circles, right? Destiny is a great example. A lot of people are scared to go against him because there's this idea out there. It's not true, to be clear. I don't believe it, but the idea existing makes it so people behave in certain ways. That if you cross certain lines with him, that the bridge will be burned and you will be destroyed and you will lose all. He's going to send tons of hate your way. We had a gentleman, I think it was a gentleman earlier, again, bring this up, saying, "Oh, you read that super chat. That means that did you apologize to Destiny or did the bridge burn?" And again, neither, because Destiny isn't going to be punishing me for having an opinion or reading a super chat or anything like that. Of course he wouldn't. I don't know. It's not so much what you do, it's how you do it when it comes to these things. there's ways to disagree and there's ways to agree. I don't know. Now I'm just ranting. Gang, it's been a fun stream. I hope you guys enjoyed it. We talked about a lot. If you've enjoyed this content, please hit that like button. Please hit that subscribe button. Tomorrow's New Year's Eve. I hope everyone, if I don't see ya, and I might not because I might do something. I don't know. I might stream. I might just do a call-in show. I'm not sure yet. But if I don't see ya, Happy New Year, gang. And I'll see you Wednesday. Let's raid out. Let's raid in Prime Kai. And let him know that this is a hate raid. Okay. And yeah, I'll see you guys Wednesday, 6 p.m. Eastern. Peace out, Girl Scouts.